Okay, my name is Caitlin, and I'm going to be performing a head-to-toe assessment. I'm going to scan the room real quick. Okay, and the ceiling. And the floor. Okay. Probably have to move my little tripod around a lot. So I would make sure that my patient would be in a gown. For the purpose of this video, he's staying in his clothes, but it would be a lot easier to assess skin to skin and assess certain things. If the patient was in a gown, I'm always going to perform hand hygiene whenever I come in and introduce myself. Can you tell me your name and date of birth?
Tyler Fox, June 23rd, 1995.
Okay, and what did you have for breakfast this morning?
An apple.
And what did you do yesterday?
Hung out around the house.
Okay, and what would you do if the house caught on fire?
I would get out of the house.
So abstract thinking is intact. I'm not seeing any flight of ideas. Short-term memory sounds good. If you will remember the phrase apple ball tree for me, I'm going to ask you to recall that later.
Okay.
All right. So I'm going to go ahead and do my general survey. The patient has, fix this for a minute. Patient has good posture.
Turn it.
Yep. Patient has good posture. He's dressed appropriately. He appears to have good hygiene. He looks appropriate for his stated age. I'm gonna visually inspect the skin throughout my assessment as well as the nails. On the skin, I'm looking for any lesions, abnormal marking, redness. On the nails, I'm looking for any clubbing, cyanosis, discoloration. I'm looking at the face to make sure that everything looks symmetrical. The ears are aligned. I see the eyes are symmetrical. The nose appears to be in proper alignment, and the mouth does not appear to have any deformities. I see that the patient has some tattoos, but I'm not seeing any skin lesions or abnormalities there. I'm going to go ahead and assess the scalp and the head. I'm feeling for any abnormal lesions, lumps, or bumps, and I'm also checking the hair. The hair is silky soft. I'm not seeing any signs of nits or infestations. I'm going to go ahead and palpate both ears. Are you feeling any tenderness there?
No.
Okay. And the nose? How about that? No. Okay. And I'm going to palpate the frontal and maxillary sinuses. Any tenderness?
No.
Okay. I'm not feeling any swelling. Could you go ahead and click your jaw for me? Okay. Cranial nerve 5 is intact. If you could open and close. Okay, just assessing the TMJ. I'm not feeling any popping, clicking. It feels smooth. I'm going to test the facial nerve. If you will smile, puff out your cheeks, raise your eyebrows, and shut your eyes tightly. I'm going to try to open them. Okay, cranial nerve 7 is intact. I'm going to go ahead and test cranial nerve, the spinal accessory nerve. If you will push against my hands. Okay, that's intact. And let's go ahead and do the neurological portion. That's actually probably good for now. If you will close your eyes and hold out your hand and tell me what's in your hand.
The marker.
Okay, and hold your palm out. And what number am I drawing?
An 8.
Good. I'm gonna go ahead and assess sensations of the face and the upper and lower extremity, gravesthesia and stereogenesis are intact. So I have a soft and a sharp. If you'll just tell me what you feel and where you feel it.
Okay. Soft on my forehead. Sharp on my left cheek.
Mhm.
Soft on my left arm. Sharp on my left arm. Sharp on my left leg. Soft on my left leg. Sharp on my left foot.
And I'm also going to test 2-point discrimination. I have this little charging clock here. If you'll keep your eyes closed and tell me whether you feel 1 point or 2 and where you feel it.
2 on my forehead.
Mm-hmm.
1 on my left cheek.
Mm-hmm.
2 on my left leg. 1 on my left leg.
Yep.
2 on my feet. Left
Good.
foot.
Good. And I would assess that bilaterally. Okay. Also going to assess the lymph nodes. Starting with this. Starting with the pre-auricular in front of the ear, post-auricular behind the ear, the occipital at the base of the neck, the peritonsillar, and the submental, or the submandibular, and the submental under the chin. We also have the supraclavicular above the clavicle and the infraclavicular. Move your shirt here a little bit. We also have the inguinal lymph nodes that we would assess at the hypogastric area that I'm not going to assess for the purpose of this video, but we would want to assess that as well. And our full head to toe, I'm looking to make sure that there's no erythema, there's no signs of swelling, no hard masses, no tenderness, anything like that. I'm also going to go ahead and assess your thyroid. If you'll turn towards the window for me. And I'm going to displace it to the left if you'll swallow. And to the right. Okay, good. There's no tenderness, swelling, no signs of goiter. Did you feel any tenderness?
No.
Okay. Alright, you can turn back around. Also see that the trachea appears to be midline. There appears to be no use of accessory muscles, no tripoding. I'm gonna go ahead and grab my, it's hard to stay in frame here. I'm gonna grab my ophthalmoscope and begin with my eye exam. Okay, so first I'm just looking at the exterior part of the eye. I'm looking at the eyebrows, the eyelashes, the macula. I'm looking at the iris, the pupil, the sclera, making sure that there's no discoloration, looking at the conjunctiva and the lacrimal ducts to make sure that there's no swelling or excess drainage, which I don't see or feel. And now I'm going to perform an ophthalmic exam. If you'll just look straight for me and get real close for a second. I'm looking at the optic disc, the vessels, the fovea centralis, just making sure that the vessels don't look enlarged or irregular. Everything looks good. Next, I'm going to test optic nerve, or cranial nerve 2, the optic nerve. If you will hold this 14 inches from me, our little Snellen chart, and read the lowest line that you can.
LTFPH.
Okay, he read the furthest line, so that means he can see at 20 feet what a person with perfect vision can see at 20 feet. He doesn't wear corrective lenses. If he did, we would test with and without, and we would also normally test one eye at a time, as well as both eyes, but for the purpose of the video, I'm testing both. Also going to make sure the pupils are direct and consensual, and test for extraocular movements. It's testing cranial nerve 2 and 3, and the Snellen chart was testing cranial nerve 2. If you'll just look straight. Okay, the pupils are direct and consensual. Can you follow my pen light? And accommodating as well. Follow my pen light again. Testing the extraocular movements. Okay, those are intact. And I'm going to move on to the ear. I think my thing came loose. Okay, so I already palpated the ear, visually inspected it. I see that, look at this. The ear looks properly aligned. And so I'm going to pull the pinna up and back. And I don't see any irregular amount of cerumen. I can see the tympanic membrane is a pearly gray. The cone of light is at 5 o'clock. I can also see the malleus and the bony labyrinth. And there was no excess cerumen, no drainage, no erythema, any signs of infection there. Did you feel any tenderness at all when I palpated your ear?
No.
Okay. Next, I'm going to move on to the nose. We palpated that. Did you feel any tenderness when I palpated?
No.
Okay. So then we're going, inspecting visually, I can see that it looks like it's properly aligned. No visual signs of trauma. So I'm gonna inspect on the inside. If you'll just tilt your head back. I don't see any excess drainage, erythema, edema. There doesn't appear to be any septal deviation. The turbinates look good. And if you'll occlude one side for me and breathe in and out. Can you breathe okay?
Mm-hmm.
Okay. So the nearest patent, I would want to assess and assess the inside and the patency bilaterally. If you'll close your eyes for me, I'm going to assess the olfactory cranial nerve. If you tell me what you smell.
Hand sanitizer.
Okay. Cranial nerve 1 is intact. And I'm going to do the mouth next. So visually, I can see that there's no signs of dehydration. The skin color is consistent with the rest of his face. If you'll smile for me, open. Okay, I'm looking at the dentition and the gums. I'm not seeing any signs of bleeding or dental caries. Will you raise your tongue for me? Looking at the floor of the mouth, I'm not seeing any signs of lesions. You can put it down. Looking at the back of the mouth, the tongue, the mucosa, not seeing any lesions, excess redness, drainage, erythema. I'm also looking at the posterior pharynx and the tonsils. I'm not seeing any edema, drainage, redness, anything to indicate a possible infection. If you would, could you open your mouth one more time? Say ah. Okay, the uvula rises and falls equally, so cranial nerve 9 and 10 are intact. And if you will open your mouth one more time and move your tongue side to side. Okay, hypoglossal nerve is intact as well. For the neck, we already palpated. Okay. So I'm going to go ahead and test your reflexes. Okay. I'm going to start with your bicep. Okay, that was +2. Okay. And the brachioradialis. All right. Patellar. All right. And the Achilles, you can just relax your leg. All right. And Babinski, we don't want to see any toe curling. Good. So those were all +2. I would want to perform that bilaterally. With the ears, I'm going to go ahead and perform a couple hearing tests. If you will plug this side, and I'm going to whisper something behind your ear and let me know what I'm whispering.
Football.
Okay. Test the acoustic nerve. And we're going to do the Weber and Renee test. If you will let me know whether you feel or whether you hear equally on both sides or more on one side than the other.
Okay. Equal.
Okay. And I'm going to do it again on the bone behind your ear. If you'll let me know when you stop hearing it, and then again beside your ear.
Okay. No. No.
Okay. So air conduction is greater than bone conduction, which is an expected finding. Okay. I'm going to go ahead and test your pulses. Starting with the carotid. Do one at a time so that we're not occluding. It's +2. And +2. Do the radial pulse. +2. And to the posterior tibial, +2, and the dorsalis pedis is +2 as well. I'll do that bilaterally. I'm also going to do the popliteal whenever we are laying down. I'm going to assess the upper and lower extremities for any edema. No pitting edema in the lower extremities. None in the upper as well. Capillary refill is good in the upper and the lower. Less than 2 seconds for both. I would assess that bilaterally. Okay. Can I get you to lay down for me? Okay. I'm gonna go ahead and assess that popliteal pulse real quick. That is a +2. I would assess bilaterally. I'm going to auscultate the carotid pulses with the bell and the diaphragm. If you'll just take a deep breath and hold it whenever my stethoscope touches your skin. Okay, you can let it out. Again. You can breathe. And one more time. Okay, regular rate and rhythm bilaterally. Didn't hear any bruits, lifts, heaves, or thrills. I'm gonna go ahead and do the cardiac sounds as well. We have the aortic point at second intercostal space, right sternal border. Pulmonic at second intercostal space, left sternal border. Erb's point at third intercostal space, left sternal border. Tricuspid at the fourth intercostal space, left sternal border, and the mitral point at the fifth intercostal space, mid-clavicular line. I'm going to listen to both of these with the bell and the diaphragm, and then again in a little bit whenever he is sitting up. Okay, regular rate and rhythm. No lifts, heaves, or thrills were heard. No bruits were heard. I'm gonna go ahead and palpate for any lifts, heaves, or thrills as well. I'm not feeling that anywhere. I'm also gonna go ahead and auscultate the lung sounds in the anterior. Just take a deep breath. And again with the bell. Okay. Respirations were equal bilaterally. No adventitious sounds were noted. I'm going to go ahead and assess the stomach area as well. I guess I'll begin with the auscultation on that as well. Bowel sounds are normal active. I'm also going to listen to the aorta, the renal artery, iliac artery, and the femoral artery with the bell for any bruits. Okay, I didn't hear any bruits. I would do that bilaterally. I'm also gonna percuss. Okay, I'm hearing resonance throughout, which means that there's just air, which is what we should hear. I'm also gonna do the liver span, where I feel, or where I hear dullness, and then I'm gonna measure this. It's about 10 centimeters, which is expected. I'm also gonna palpate the spleen, which I can't feel, which is an expected finding, and the kidneys. No abnormalities there. I'm going to lightly palpate and then deep palpation if you will let me know if you feel any tenderness.
Okay.
Anything?
No.
No tenderness?
No.
Okay, good. Like I said earlier, I would also assess the inguinal lymph nodes at this point as well. You can, well, let me assess your jugular vein distension really quick. If you will look that way, at a 30-degree angle, I can see his jugular vein pulsating, but it is not bounding or overly distended. If it was, I would want to measure that and complete further testing if necessary. I'm also going to test his hepatojugular reflux by pressing down on that vein, and you will see the jugular vein distend. You would hold this here for a full minute, and then whenever you release, it should suspend back down. If not, that indicates some sort of abnormality. Okay, now you can sit up. I'm going to do the posterior part of the respiratory. So you can turn and face the window. Okay, first I'm just going to visually inspect the back and make sure that there's no lesions, no skin issues, make sure that there's no signs of irregular breathing. I'm also going to palpate for any tenderness or masses, any irregularities, which I'm not feeling. We're going to palpate for CDA tenderness. Let me know if you feel any tenderness here. Anything?
No.
Okay, good. All right, and I'm going to go ahead and I'm going to percuss and then palpate. So I'm going to percuss from the apex to the base. I want to hear resonance because the lungs are air-filled. Okay, good. I heard resonance, which means that there's no dullness, no fluid accumulation in the lungs. And now I'm going to auscultate. And laterally as well. I see that his AP ratio is 1 to 2. Sorry, I didn't realize I was out of frame. And chest expansion appears to be equal bilaterally. If you will, just take a deep breath in and out. Okay, chest expansion is equal. And I'm going to test tactile firmness if you will say 99 every time my hands touch your back, okay?
Okay. 99. 99. 99. 99. 99.
Okay, it's equal bilaterally, which is an expected finding. You can turn back around. I'm going to go ahead and assess your walking and your spine, if you'll stand up for me. And you can just walk normally over to the end of the bed. Okay, and heel to toe. Okay, and tippy toes. And I'm going to go ahead and assess your spine. Let me know if you feel any abnormalities, any tenderness. No signs of lordosis, kyphosis, scoliosis. If you will lean forward for me and backwards, side to side, and rotate. There you go. Good. Okay, you can sit back down. Alright. And going to assess your joints. So we already kind of assessed your neck. Do you feel any abnormalities there?
No.
Okay. I don't feel any excess warmth, edema, no masses, abnormalities there. If you can, for me, rotate your neck and bend it both sides, back and forth, laterally. Good. And your shoulder. Not feeling any erythema, masses, abnormal temperatures. Can you extend or flex, extend, and adduct, and rotate. Okay. The elbow, again, not feeling any abnormalities. If you'll go ahead and flex and extend and pronate, supinate. Good. The wrist, not feeling any bony abnormalities, edema, temperature abnormalities, and the fingers as well. Any tenderness?
No.
Okay, good. So we're gonna flex, extend, rotate, good. And ulnar deviate, radial deviate, good. And flex and extend, good. I would do that bilaterally. I'm gonna do the lower extremities, testing the knee, making sure I'm not feeling any abnormal warmth, edema, any irregular masses. Okay, if you'll go ahead and flex and extend your knee. Good. And what about your ankle or your feet? Yeah. Okay. And your ankle. Not feeling any abnormalities. Okay, if you can go ahead and dorsiflex, plantar flex, inversion, eversion, and flex and extend your toes. Good. And you can lay back down one more time and assess your hips. Okay, so I don't see any visible signs of asymmetry in the hips anywhere. It looks good. If you can flex and extend your hip. Good. I think that concludes my exam. Thank you.